If you love your penis, don't skip this video. Take a few minutes of your valuable time to watch, because what I'm about to share may truly surprise you. I'm Dr. Laura, a urologist, and today, I'm going to walk you through 10 things you should absolutely never do to your penis. These are common mistakes that can cause real harm, many of which most men have never even heard about. As a urologist, I see all kinds of issues involving the penis, from injuries and discomfort to serious complications that often result from something as simple as not knowing better. And I'm here to help you avoid those outcomes. In this video, I'll also share 10 things you should be doing to support the health of your penis, things that might not be on your radar at all. And please stick around through number 10. It's the one that surprises most people. Let's not wait any longer. Let's get started. Number 1. Don't ignore your penis. Its health reflects your overall health. Many men tend to only pay attention to their penis when something goes wrong, like pain, trouble maintaining an erection, or a drop in sexual desire. But these aren't just sexual issues. The truth is, the penis isn't just a reproductive organ, it's an early warning system for your overall health, especially when it comes to your cardiovascular, hormonal, or nervous systems. A large study published in the Journal of the American College of Cardiology found that men who experience erectile dysfunction have a higher risk of developing heart disease even if they have no prior history of cardiac problems. In a 7-year analysis, 14% of men who began experiencing erectile issues went on to have a heart attack during the follow-up period. That's why medical professionals often refer to erectile dysfunction as the canary in the coal mine. In other words, it's an early warning sign of something deeper going wrong. When the penis starts to malfunction, it can mean your blood vessels are narrowing, your circulation is declining, your testosterone levels are dropping, or your nervous system isn't functioning as it should. Why is that? Because in order to achieve a healthy erection, your body needs a well-functioning cardiovascular system, balanced hormones, a responsive nervous system, and stable mental health. So when you have strong erections and a healthy sex drive, it tells us that your blood is flowing well, your heart and blood vessels are in good shape, your testosterone and other male hormones are within a healthy range, your nervous system is sending and receiving signals effectively, your mood is stable, you're not overwhelmed by chronic stress, and you're likely not using substances or medications that negatively affect sexual function. So don't ignore changes in your penis, and certainly don't dismiss them. Don't be afraid to talk about it. Don't be afraid to get it checked. And please, don't underestimate the signals your body may be trying to send you every single day. Number 2. Don't DIY things for your penis. Gentlemen, I need to have a frank conversation with you about something I see far too often in my practice. After decades of treating men's health issues, I can tell you with absolute certainty, there is no safe, at-home remedy that will make your penis longer or thicker. I understand the frustration and desperation many men feel about penile health concerns. Whether it's size anxiety or erectile difficulties, the market is flooded with promises of quick fixes and miracle solutions. But let me be crystal clear, these DIY approaches aren't just ineffective, they are dangerous. Medical experts consistently warn against penis enlargement products and DIY methods, yet men continue to try everything from apple cider vinegar applications to homemade concoctions they find online. These methods have no scientific backing whatsoever. Surgery is unlikely to significantly increase penis size unless a person has a specific medical condition, and even then, risks include distortion, scarring, and infection. Let me share some real-world examples of what happens when men take matters into their own hands. One of the most common DIY methods I encounter is something called jelqing, a manual stretching technique where men use their hands to apply pressure and stretch the penis, believing it will increase length or girth over time. Here's the medical reality. The risks of jelqing greatly outweigh any potential benefits, as you can create permanent tissue and nerve damage, as well as long-term erectile dysfunction. Aggressive jelqing can cause penile fracture, a medical emergency requiring immediate surgical intervention. I've treated young men in their 20s and 30s who came to my office with serious erectile dysfunction, not from any underlying health condition, but from jelqing injuries. Even experienced urologic surgeons cannot exert sufficient control over ham strength to lengthen the penis without causing organ damage. If a trained surgeon can't do it safely, what makes you think you can? The problem with jelqing is that it causes microscopic tears and fractures in penile tissue over time. Risks include pain, soreness, bruising, skin irritation, and increased risk of developing Peyronie's disease. And here's what I know about men: if I tell you to do something to help your body, you're not going to do it halfway. You're going all in, which means you're likely to overdo it and cause irreversible damage. Another dangerous trend I've encountered involves men creating their own constriction devices at home. Let me share 2 real cases that illustrate why this is such a terrible idea. I once had a patient who used a metal construction nut as a makeshift constriction ring. He had been drinking when he put it on, then passed out. By the time he arrived at the emergency room, his penis was so swollen that the ring was completely embedded. We had to call the fire department to bring a reciprocating saw to cut it off. This man nearly lost his penis because he didn't want to spend $20 on a proper medical device. Another case involved a gentleman who cut a ring from a plastic Coca-Cola bottle. Plastic may seem safer than metal, but once it gets stuck, it can be just as dangerous. The irregular edges caused lacerations, and the rigid plastic wouldn't stretch to accommodate the swelling. Even legitimate penile enhancement procedures carry serious risks, including scarring, pain, infection, loss of sensation, and erectile dysfunction. Imagine the risks when you're using hardware store supplies or kitchen utensils. Medical literature documents that penile enlargement attempts can result in sexually disabling deformity, severe shortening, curvature, infection, and sexual dysfunction. These aren't rare complications. They are predictable outcomes when you try to modify such delicate anatomy without proper medical supervision. The penis isn't like other parts of your body. It's not a muscle that responds to exercise. It's comprised of specialized erectile tissue with complex blood flow patterns and nerve pathways. The penis does not respond to physical manipulation the same way other muscles do. What you should do instead: if you're concerned about penile health, size, or function, the answer isn't a DIY project. It's a conversation with a qualified urologist. We've seen every concern you might have, and we can discuss legitimate treatment options if they are medically appropriate. For erectile function, focus on overall health, regular exercise, proper nutrition, stress management, adequate sleep, and avoiding smoking and excessive alcohol. These lifestyle factors have more impact on sexual health than any gadget or technique you'll find online. If you're using constriction devices for erectile dysfunction, invest in a proper medical-grade device designed for safe removal. You can find FDA-approved options for around $20 online. Your penis is worth more than the money you'll save by improvising. Number 3. Keep your penis clean. I think everyone realizes that they should keep their penis clean. But what happens is when guys have a foreskin, sometimes you forget to pull the foreskin back, or clean under there or dry under there, and that can lead to things like balanitis, where you get infections of the foreskin, and it can be very uncomfortable. So make sure you are always taking the time. Pull back the foreskin, clean under there. If you can't pull it back, that's a problem. While penile cancer is exceedingly rare, there are cases where people will develop a cancer on their penis, and because they could never pull back their foreskin, they can't see it. So I always tell people, make sure you can pull your foreskin back. If you can't, make sure you talk to your urologist, talk to your doctor. Sometimes it can be reversed by using a cream or a small device, or you could have a circumcision. But ultimately, you always want to be able to pull it back, clean under there, look, inspect your penis, and put it back. In that same vein, I would avoid aggressive cleaning, because I think sometimes people will use these really scented or strong soaps, and this can actually cause irritation. The skin on your penis is not meant to be aggressively washed. It should be clean. Let soapy water run through. Make sure there's no smegma buildup and keep it clean. But don't be aggressive. Don't wash it aggressively. Don't rub it aggressively, because you will cause irritation of the skin and maybe even lacerations. Number 4. Don't ignore pain. Pain or other warning signs. If you guys see a problem with your penis, please talk to your doctor. Don't ignore it. Sometimes it could mean you have a sexually transmitted infection. Sometimes it could be a urinary tract infection. And sometimes, if you see blood in your urine, that may be a sign of kidney stones, bladder stones, or something more serious, possibly cancer. It could be bladder cancer, or even penile cancer if you notice a sore on your penis. So please, don't ignore it. I understand how difficult and uncomfortable it can be to go to a doctor, show them your genital area, and feel like you're being judged, especially if you've had unprotected sex. I truly understand. But your health is not worth the price of silence. If you feel judged, please look for another doctor. But at the end of the day, our goal is the same: to keep you safe and healthy. I've seen many patients who came in too late, simply because they were afraid or embarrassed. Early signs like redness, itching, or discharge are often easy to overlook, but that's exactly when we have the best chance to treat things effectively. You should also do daily self-checks. Look out for any sores, lumps, discharge, or changes in color. The earlier you detect a problem, the better your chances of successful treatment. Number 5. Stay in control and be safe. There is nothing hotter than safe sex. Practicing safe sex allows you to relax completely, without worrying about sexually transmitted infections or unintended pregnancy. And that peace of mind creates the best possible sexual experience. There are many ways to have safe sex. There are many different types of condoms, and you'll need to experiment a bit to find the one that works best for you, the one that's thinnest and provides the best sensation for both you and your partner. Safety should always come first, no matter the situation. Now, speaking of safety, there's something else I want to talk about: staying in control. Why is that important? Because certain injuries can happen during sex, such as penile fracture. When sex gets very vigorous, your penis is fully erect, and if it bends forcefully from hitting the pubic bone, it can actually break. This is a true surgical emergency. If that happens, you need to go to the emergency room right away, and we will likely need to take you to surgery to repair the tear. If not treated promptly, up to 50% of men may develop permanent erectile dysfunction. And you will know when it happens. You'll hear a popping sound, you'll feel significant pain, and your penis will swell up quickly, often looking like an eggplant. The best way to prevent this is to stay in control. Control the speed and the angle of movement by holding your partner's hips. Avoid rough or uncontrolled thrusting. And here's something else that really helps: lubrication. Lube keeps things smooth and enjoyable. Don't hesitate to use it, it's better than you might think. And importantly, don't assume that your partner's lack of natural lubrication means they're not aroused. This is a completely normal part of aging. Women tend to experience reduced lubrication during perimenopause and menopause. And sometimes, younger women may also produce less lubrication due to medications, genetics, or other factors. Number 6. Don't make it hot. I mean that you want to keep your testicles in a relatively cool environment. So the reason that testicles hang outside the male body whereas women's ovaries are inside is because they need a very perfect temperature in order to produce sperm. If you expose your testicles to a lot of wet heat, this can lead to changes in your body's ability to produce sperm, which can then lead to infertility. And it can potentially affect your testosterone. So what I would say is avoid having a lot of exposure to things like jacuzzis, steam rooms, things like that. Try to limit your exposure to them. Also, when you are sitting or using a laptop, try to make sure you have something in between your genitals and the laptop. Ideally, keep your phone in your back pocket, not in your front pocket, because all of these things emit heat, and they can affect your testicular health. Number 7. Be gentle and kind to it. What I mean is when you masturbate, try not to be too rough with your penis. A very tight grip and fast motion, well, that's not something you can realistically replicate during partnered sex. Over time, your body can become conditioned to that level of intensity and pressure, and that's something you won't be able to reproduce with another person. You might eventually notice that you start having difficulty getting aroused or maintaining an erection because the stimulation feels so different. So I always say be kind to it. Try to masturbate in a way that's more similar to how you would be stimulated during sex with a partner. Use lubrication and allow yourself to enjoy the experience. Don't turn it into something rushed or shameful like hiding in the corner and trying to finish as fast as possible. Number 8. Don't smoke and take care of your health. Guys, smoking will kill your erections. 100%. Smoking will cause erectile dysfunction, so please don't smoke. I see smokers with bladder cancer all the time. It's one of the worst kinds of cancer, and sometimes, when we have to perform surgery, these are major operations that can significantly change your life. Overall, your lifestyle matters a lot, and it has a huge impact on your penile health. Do you remember what I mentioned back in point number 1? That over a 7-year period, 14% of men with erectile dysfunction will go on to have a heart attack. That's because erectile dysfunction is a marker of blood flow. It's a marker of many different things. It's a biological sign of your overall health. And so, if you stay healthy, your erections are more likely to stay healthy too. Follow a healthy diet. Avoid smoking or overuse of any substances. Try to limit alcohol intake and exercise regularly. Both aerobic exercise and resistance training are essential. Aerobic exercise is great for your blood flow, and resistance training helps support healthy testosterone levels. So all of those things are so important, and I can't stress them enough. If you're not sure how to start, just begin with one small step. Do something so simple that it feels impossible not to follow through. And finally, try to manage stress. A little stress is okay. We need some stress in our lives. But if you're dealing with chronic stress, it can take a serious toll on your overall health, including your sex drive and your ability to maintain erections. So if you notice that you're living with chronic stress, it's worth doing some work to understand where it's coming from and what's within your control to improve your quality of life. Number 9. Be nice to yourself. I find that when men experience difficulties with their penis, they tend to be very hard on themselves. They feel a great deal of stress about being with their partner, about how their penis looks, how it functions, and this anxiety builds up around intimacy. And that only makes things worse, right? For example, let's say you have a problem in the bedroom, you can't get an erection one time. The next time you try to have sex, you're thinking about that the entire time. And that stress makes it even harder to get an erection. So then you don't get one, and the anxiety grows, and it turns into this vicious cycle. So please, be kind to yourself. Everyone has fluctuations in their erectile function. There will be times when it just doesn't work, and that's okay. An occasional issue doesn't mean your sex life is over. It will come back, but don't beat yourself up and keep fueling that cycle of stress. Number 10. Use it or lose it. The saying, use it or lose it, is somewhat true. Many men stop having sex because they can no longer get an erection. They feel embarrassed, stressed, or their partner has also lost interest. However, the real issue arises when they not only stop having sex, but also stop having nighttime erections. Typically, men have 3 to 5 erections during the night. These erections help deliver oxygen-rich blood to the penis and maintain healthy tissue. Without them, the penis may begin to shrink, and the tissue may change, potentially leading to scarring. In addition, when your sex drive decreases, whether due to stress, hormonal imbalances, or other reasons, and you avoid sexual activity for a period of time, your body may start to learn that it no longer needs it. As a result, your sex drive may continue to decline simply because you've stopped allowing yourself to feel that urge. While this may not be a concern for some individuals, it can become a problem if you're in a relationship and your partner still desires intimacy. I believe that sex and intimacy with your partner offer many benefits, no matter your age or circumstances. It's an important part of your health and overall quality of life. Both you and your partner need to make time and effort for it. You may not always be in the mood at the same time, but that intimate connection still carries great value. Follow my channel for helpful information that can improve your sex life. Don't miss out. And as always, take good care of yourself because you truly deserve it.